You are joining the webinar that is part of the IFMBE CED 2020 Competency and Leadership in Clinical Engineering. This series of webinars specifically address the skills and knowledge that we believe leaders and clinical engineers need to have. One of them is how to publish my clinical engineering research. My name is Yadin David. I will be happy to co-moderate today's webinar with Leandro Pecchia from the Warwick University. He is Associate Professor of Biomedical Engineering as well as Director of the Applied Biomedical Signal Processing and Intelligent e-Health Lab. Leandro as well is officer with CED division of IFMBE, EU PESM, and the EMBS organization in Europe. After my introduction, I will ask Leandro to help me moderate the panelists, the faculty, and introduce the speakers. The order of the speeches today would be starting with Professor Emeritus Nicholas Palikarakis from INBIT in Patras, Greece. And then we'll move to Professor Dan Clark, Director of Clinical Engineering in Nottingham Hospital System. Then Xiaomin Lu from Hangzhou, China. And then to Ilir Kuloli, who is the Director of Clinical Engineering at Stanford Medical Center Children's Hospital and President of the American College of Clinical Engineering. As always, at the bottom of the screen, you have a tab Q&A. If you hit that tab, you will open a window that would allow you to send questions directly to the faculty. So we would like you to use that as contrast with the chat. Let me start by having a couple minutes just to introduce the idea. We felt, based on feedback we got from all of you back in 2015 in the International Congress of Clinical Engineering and Health Technology Management Congress, in Sao Paulo Congress 2 years later, in Rome Congress last year, that there is difficulty to get clinical engineers to write about the work. And we wanted to overcome it by, first of all, offer an opportunity, a stage, a platform for clinical engineering work to be published. As a result, we founded the Global Clinical Engineering Journal, which is a diamond open access online, www.globalce.org, as you can see on the screen now. And it is a peer-reviewed, double-blind journal that is available free of charge to author to submit, to readers to read, and to library to contain within their domain of resources. Let's take a look at the website. This is the home page. When you get to this website, on the top right corner, you can see the yellow arrow where you can register. We would like you to register so you can get our future journal announcement when we publish them. If you want to make a submission, again, on the right-hand side, you can see the red arrows. And when you select to make a submission, what you will be landing on is on a very clear and easy to follow checklist that has instruction what you should do, and how do you complete your submission. There is a author guidelines, copyright notice statement, privacy statement. All of those are available on selection of the tabs on front. Here's an example of what you see when you select author guidelines. If we can go back to the home page for a second, you see on the right-hand side the editorial team. I'm very proud with the editorial team that we have put together to support the review and the publication of our issues. There is representation from every corner of the world: UK, USA, China, Italy, South Africa, India, and the World Health Organization as well. Not only geographically we are well represented, but also the talent and the field of expertise that these editors bring to the Journal of Clinical Engineering is tremendously wide. We have practicing clinical engineers, we have academic practitioners in the field of clinical engineers, we have physicians, we have surgeons, we have entrepreneurs, and we have people who are specialized in regulatory and international e-health and telemedicine. This is a tremendous opportunity for us to tell our friends, this is the place where we need to go and publish. And I would like to let you know that we have something called online first, which means that if you submit a paper and we went through the review and decided to publish it, you don't have to wait until we have a full issue at the end of the quarter to get published, but immediately. I mean, within days, you get your paper online, well archived, marked with ORCID numbers and DOI numbers, all the things that are appropriate for get credit for your publication. So I hope that you are encouraged to look into that. And now we'll go to our presentation. You can, as you see on the screen, if you want to download any one of the paper in the journal, you can go to the PDF tab on the right-hand side, and immediately when you click on it, you get the full paper. For example, this paper we just published on Submission Style Guide for the Global Clinical Engineering Journal is giving you details. How do you title your paper? How long the abstract should be? What are considered to be methods, etc., etc. Everything is there. You can download by selecting on the right-hand column the button, and you have the paper. I would like to jump into the real presentation. This is just introduction. I would call on Leandro just to see, Leandro, if you have additional introductory note before we continue.